those of you who suffer from musculoskeletal problems, that's anything to do with the body's muscles, joints or nerves, might be interested in a new service from NHS Hull. Physio Direct allows you to talk directly to a chartered physiotherapist on the phone about advice and appropriate management of your problem.
Hello, Hull Physio Direct.
Previously, to access a physio, you probably have to be referred by your doctor, and you may still need to see your doctor in certain circumstances. But now you can call 01482 300 003 and you can talk to a fully qualified, experienced physiotherapist without seeing your GP first. The service is available Monday to Friday, 8 till 5:30, and you'll be able to get immediate advice and help to improve your problem in just a few minutes at your convenience. Let's find out how it works.
When a patient rings Physio Direct, we will tell them briefly how the service works. Then we'll ask them some general details, baseline questions like name, address, date of birth, and then we can register their referral and link it into their GP record. We then ask the patient what the problem is, what the main symptoms are, what sort of treatment they've had in the past, if any. Once we've collected all the information regarding their problem, we'll ask them other important questions like any other medical history, any medication and their occupation. Once we've gathered all the information, we'll tell the patient what we think the problem is and then how best we can help them.
What's your first name and date of birth? What were you previously seeing them for? What joint was it? Your knee was giving you bother, was it?
Well, the advice will depend on the MSK problem, but most patients that call us will certainly benefit from a home management programme. This will take the form of some advice and some form of home exercises. For example, if someone's got an acute problem with some swelling, ice treatment might be a good option. If someone calls with a bad back, postural advice will be very important. We can talk the patient through the advice on the telephone and then back that up with written information, and we can either send or email the patient some exercises or advice.
We're just going to go through some questions with you just to find out a little bit more about your problem, because you know all about it but I don't yet. Tell me a little bit about your knee. Which knee is it? Your left knee. Okay. And how long ago did things start? Have you been told you've got arthritis in the knee? We've had people calling up who just want simple advice over the phone. They're very busy sort of individuals, and they don't want to take time out of the day, and they just want something, a quick answer to what's possibly going on and some exercises to be getting on with. We've had people who are in, to the other extreme, where they're in dire need and they're, begging and pleading to come in and see somebody because they're so worried about the problem, it's how much it's affecting kind of their daily life and things like this, and stopping them being able to do things.
Once the physiotherapist has decided what the problem is, they will discuss with you the best way to treat it. Not everybody needs to be seen face to face. Some people may get better with a home management plan. If the physiotherapist decides that a face-to-face appointment is right for you, they will organise this with you. An immediate appointment will be offered if the problem is urgent, for example, severe back pain in pregnancy. Your appointment to see the physiotherapist will take place at a venue as close to your home as possible. You may also be referred to another service, for example, the fall service, if mobility or a risk of falling is a problem. Whatever the outcome of your call, you are more than welcome to call back if you want further help or advice.
One lady rang me a little while ago. She self-referred herself to Physio Direct. She hadn't seen her doctor. She complained of a pain in her elbow following a pulling injury. I think her horse had managed to pull her over the weekend. She had a lot of pain on the front of her elbow, and she'd also lost a lot of range of movement in it. I felt this was very important for us to take a look at this fairly urgently, as it was quite a recent injury. She came in to see me that afternoon, and I wasn't happy with the clinical symptoms, so I requested an X-ray. As it turned out, she'd fractured one of the bones in her elbow, and I was able to book her into fracture clinic that week for further management.
The first one that comes to mind was a lady who called who was getting problems when she was sitting driving. She worked over in Leeds, so sometimes she's got the train across there static for long periods. She was having problems picking her kids up and bending and lifting and carrying type sort of things, and stood at the sink, that sort of thing. And she was getting back pain, but she was also getting some referral down into her calf area and her foot, some pins and needles. That's classically what we kind of think is termed as a sciatica type problem. Going through the questions that we go through normally, asking what makes it worse and better and things like that, it turned out that it was along the lines of what we call a mechanical problem. So depending on the positions and the postures and things, depends on what happens with the nerve irritation. Talked through some postural advice about what to do, about using lumbar rolls and things like this, and how to sit and trying to move when she's on the train so she's not sat for long periods. And also talked about trying some exercises. Now, whilst I was going a bit quiet, printing out some details to send off to the GP in the various places and to post to her, she was actually trying some of the exercises on the other end of the phone. Hadn't told her to do that, but she was just trying them, and it actually started to relieve some of her leg pain quite quickly. The perfect example of what we're trying to offer to get people immediate sort of access to the service and deal with their MSK problems.
One of the great advantages of the phone line is that you can talk to a physiotherapist about your condition, and you can start to manage your problem straight away by acting on their advice. Even if you're waiting for an appointment to see a physiotherapist, you can greatly improve your condition while you wait. Physio Direct is available on 01482 300 003 and is brought to you by NHS Hull.